ProTouch is a 1470 nanometer novel diode laser. It has a high water absorption coefficient and is readily absorbed by oxyhemoglobin, allowing for low char hemostatic tissue removal. Equipment used includes but is not limited to the ProTouch diode laser, the 600 micron end-firing diode laser fiber, the 26 French continuous flow resectoscope, offset rigid nephroscope, and Piranha morcellator. Our patient was a 75-year-old male with symptomatic BPH managed medically. He went into acute urinary retention. His prostate volume was 100 grams, and his IPSS was 35 and quality of life score was 6. He decided to proceed with ProLEP. After performing a complete cystoscopic exam using the 26 French Wolf laser resectoscope, the 600 micron ProTouch laser fiber was advanced beyond the beak of the scope and secured in place. An area just lateral to the verumontanum was marked with a laser to identify the distalmost end of the resection. An incision is made at the 5 o'clock position at a groove in between the median and left lateral lobe at the level of the bladder neck. This incision was carried to the previously marked incision lateral to the verumontanum. This incision is carried to the prostate floor, and the fibers of the bladder neck are incised so that this incision is flush with the bladder. At the 7 o'clock position, a mirror incision is made on the right. Using the laser, the mucosal bridge is then transected just proximal to the verumontanum. Using the beak of the resectoscope, the median lobe is then enucleated backwards towards the bladder and decapitated at the level of the bladder neck. Next, attention is turned to the left lateral lobe. An incision is carried along the floor of the prostate laterally to free the apex of the left lateral lobe. This is aided by gentle manipulation of the beak of the laser resectoscope. A plane is developed between the left lateral lobe and the prostate capsule and carried circumferentially towards the 12 o'clock position. At the 12 o'clock position, an incision is made to divide the anterior commissure until it connects with the previous incision. The entire left lobe is enucleated back towards the bladder in a circumferential fashion, peeling the left lobe off of the capsule. The left lobe is then transected at the level of the bladder neck. The right lateral lobe of the prostate is enucleated in a similar fashion as described for the left lateral lobe. Finally, the offset nephroscope is introduced and the Wolf Piranha morcellator is used to extract the lobes of the prostate. Here we have a brief summary of our institutional results with ProLEP. Thank you for your attention.